So yeah, just for the for the benefit of the recording, again, you just press to remove the cuff. Just press down on the small ring at the very top of the caretaker. So you're going to push down on that with your finger, and you're going to pull up with hosing, tubing at the same time, and it'll release. Okay, so I'm going to go ahead and I'm going to put my caretaker on, and then we're going to start to work our way through getting a session going. Now, obviously, when you guys are putting the caretaker on patients, it doesn't matter right or left hand, whichever hand you want. So it really boils down to the scenario. Obviously, there's trauma involving the hand, then you can put it on the opposite hand. Now, one of the things that I will say, Dr. Wilkie, is this. These finger cuffs are, the IFU is single patient use. So these cuffs can be reused multiple times across the same patient. Now, let me qualify that. We have customers in neuropsychiatry, in sleep, in dental sedation spaces that will reuse these cuffs. They're white by design. They're designed to show any soiling. But, can I officially say to you, you use this across multiple patients? No. But the reality is that we have customers that do. So I will leave it to you guys to decide if that's something that you want to do. When it comes to using these finger cuffs, we expect 25 to 75 inflation cycles out of this cuff. What that means in caretaker session terms is 25 to 75 monitoring sessions on a single cuff before it stands to probably fail. Okay, does that make sense? Right. So, over the course of time, there's an air, you guys have seen the air bladder. As it inflates and deflates over time, it becomes stressed. And at a certain point, the cuff's going to give. But we expect 25 to 75 cycles or monitoring sessions before we would expect that that's going to happen. So, I think I included with your shipment, Dr. Wilkie, extra boxes of cuffs, one extra box of cuff for each caretaker. So with each caretaker, you essentially have 20 cuffs. And if you take those 20 cuffs and you multiply that out by, 25 sessions, you're looking at, at least 500 sessions out of all those cuffs. And obviously discounting patients throwing up on the cuff, bleeding on the cuff, or not that they would, but if they go gardening in the cuff, that would be also a problem, not to happen very frequently. But anyways, that's some guidance for you in terms of reuse on the cuffs. Any questions about that?
No, sounds good.
Okay, so Raul, you've got the caretaker on, tubing plugged in, ready to go. Is the caretaker already turned on?
No, it isn't.
Okay, go ahead, press the button once on your caretaker. It'll boot up, it'll make a little vibrating noise. You'll see a caretaker splash screen, and then it'll say click to connect. Now, I want you to look in the top left corner of the caretaker screen, and you'll see some digits. Do you see those?
Hexadecimal.
Yes. Dr. Wilkie, I'm impressed. That's I don't know many people that pick that up right off the gate. So
that's pretty nerdy.
Yeah, well, you must have some coding experience or something. Anyways, that is the ID to the caretaker. So not to say that it's going to be a frequent problem, but if you had multiple caretakers, you just want to pay attention to that ID if you're trying to connect multiple caretakers in a busy environment. So let's say that you had caretakers operating in two adjacent rooms and they both happen to be click to connect at the same time. When your tablet goes looking for it, it'll see two. So you just want to make sure that you use those numbers as a reference. Now, what I'd like you to do, press the button once on the caretaker, Raul, and look in the top left corner of the screen. You should see an icon on the caretaker that's an orange Bluetooth. Do you see that?
Sir.
Okay, what that means is it means the caretaker is currently broadcasting its signal. And that's so that the tablet can go ahead and can find it. Does that make sense?
Sir.
Okay. Now, it stops broadcasting after a predetermined period of time. 20, 30 seconds. it will stop broadcasting its signal. So if you don't see it on the tablet, then you might have to press click to connect again. Okay? Now I did hear a beep in the background. I'm assuming you guys already have it connected.
Maybe.
Okay. Well, I'll tell you what.
Is it through the Chrome browser or through?
No, it's through the Caretaker app. So let's do this. Dr. Wilkie, is that tablet connected on your Wi-Fi network by any chance?
I don't know. Click the home button again.
So if I don't know was the instinctive response, then I would fathom to say it probably is not. You would have to deliberately go and connect it to your Wi-Fi. We have the ability to remote support. Is there a possibility, and Tyler, I know you're on the line, can they connect it to the Wi-Fi right now, Tyler, so I can remote connect to the unit?
So where's
Of course.
I don't use Android a lot. Where's the
So if you
iOS where to get the?
Yeah, if you drag down with your finger from the top of the
There we go.
screen, top right corner, there's a gear icon.
Yeah.
And then if you click the gear, it'll take you into settings, and you'll want to go to connections at the top.
Got it.
And then go to Wi-Fi, click on Wi-Fi, and it'll show you the available networks.
So, Tyler, do you want this on guest or private?
Well,
Put this on private.
yeah. I was going to say Tyler should chime in on that.
Okay. Sounds good. I need a password for private.
You ready? Capital T.
Hey, wait. So, text it to me. That way we're not putting this on a video that gets broadcast so everybody knows the private network password.
Oh, yes, this is being recorded. I'll do it right now.
Tyler, are you on the web chat right now?
I am. I mean, I'm looking at your participation. I just am not broadcasting the video.
What you could do is you could either text it to Dr. Wilkie, or you could private message it to him on the WebEx meeting.
Yeah, I'm just going to text it to you right now.
Okay, perfect.
That's right. I forgot that this was starting to record.
Now, one of the things I will mention to you, Dr. Wilkie, is that, and Raul, if the Android tablet ever prompts you to do a software download for updates, just decline it or say later. I believe it gives you the option to either download or remind me later, something along those lines. The reason why we prefer our customers don't update the Android is partially because it can affect the remote support app that I use to access the tablet. It's not a huge inconvenience, but if you can avoid it, that would be great. I should also note that the remote support app that I use to support the tablets does not allow for unattended access. So the only way I can access those tablets is with your permission. Okay. So Tyler, one of the things that we probably will need to get into place for you guys, if you don't already have it in place, is a BAA agreement.
Okay.
Assuming that you guys want one, I'm assuming that that's standard protocol for vendors that may have exposure to patient identifiable information.
Yeah.
Okay, we're connected to the Wi-Fi.
Great. So if you press the button on the center bottom of the tablet, go to the home screen, Dr. Wilkie. Right down in the center bottom, there's a program that looks like a medical symbol that says Splash Top.
Yep.
You can go ahead and you can open that. That would be great.
So, can we connect these to a variety of different devices? I mean, is there an app on, say, Windows? If we wanted it on a Windows Surface Book, or?
Well, so here's how so first of all, unfortunately, we don't have iOS yet. My apologies for that. That's down the line. But we do have the ability to screen share the devices to a Windows or a Mac PC. So if you wanted to remotely monitor your caretaker devices at a nursing station or a nurse's station, we can certainly do that. Okay, 427-933-057. Okay, 2 seconds here. 7. Okay, great. Thanks, Dr. Wilkie. Okay, so I'm going to connect to the tablet. It's going to prompt you. You want to click allow and I think activate. Great. Okay, so now I can actually see your tablet, and I'm going to, for the benefit of Tyler here, I'm actually going to share my screen so Tyler can kind of.
Perfect.
This one they gave us. Okay, so John, we've got 4 devices. We're going to keep 2 here in San Antonio, and we're going to give 1 to Fort Worth and 1 to Arlington. So we'll need to purchase a couple more Samsungs. Can we, if we purchase the Samsungs, can we download the app?
Yeah, I can get you guys set up, no problem. Question is it just because you want to have sort of a tablet in each room and then you just move the caretaker around, or what's the strategy?
So, well, the strategy is there's we don't have like we've got some monitors, but you have to have visual thing. We don't have any kind of remote display of vital signs. And so if there's a patient that's, say, in a room that doesn't have direct line of sight for the nurse, and they want to be able to watch the vital signs at their workstation, be able to see it on their PC or a tablet, just for continual monitoring of certain patients.
Oh, sure. Okay. Yeah. I mean, obviously, the software to set up on Mac and PC is not a problem, and I can help you with that, and I can work with Tyler on that.
Okay.
Tyler, are you familiar with Real VNC Viewer?
Oh yeah. I mean, I saw our email correspondence, and I know exactly what you guys are doing there. So no big deal.
Yeah, so you know, we just screencast the Android. The only work that you would need to do, Tyler, is set up static IP addresses for the tablets at each facility.
Okay.
And
So,
then
Tyler, I think we should do Real VNC with a bunch of Raspberry Pis.
well, Dr. Wilkie, you're piquing my interest here. You've obviously got lots of experience in things other than medicine. But yeah, I mean, there's it's easy to do. Most of our neuropsychiatry customers, we're big into ketamine as well. They use Real VNC to monitor their patients remotely as well. Now, Dr. Wilkie, if you guys ever get to the point where you're really kind of starting to expand the system, or you pick up additional monitors, we do have a portal that's quite nice that we can consolidate all the devices into. And so you could have a portal running where, you know, you'd be able to see all the patients in a single web-based browser. But that's something that we can certainly discuss offline. Okay. So let's do this. Why don't we go to the home screen of the tablet now, Dr. Wilkie? Just press, yeah, and then let's open up the Caretaker software. Okay, so right off the bat, you know, obviously you guys are already connected. Now, one of the things I'd like you to do, Raul, is I'd like you to try and just keep your hand with your Caretaker still. And obviously, if you can keep your finger away from being in contact with the surface of it, like a desk, or, you know, just the finger with the cuff on it. I just want to sort of illustrate one of the aspects to getting the Caretaker sort of connected. Normally, when you've got the Caretaker on and connected, if the cuff is on correctly, we're going to start to see a pulse pressure waveform. So my suspicion is right now that the cuff might be on a little bit too loose. I don't want you to adjust it though, and I'll tell you the reason why, because we kind of want to sort of prove this out. So what I'd like you to do is in the bottom left corner of the screen, there's a button that says Start. Go ahead and click that. Now, a couple of things to note here. Right at the top of this screen, you're going to see there's a field where you can enter in patient ID. Why don't you go ahead, tap on that, Raul or Dr. Wilkie, and just type in Raul's name. Okay. Now, let's talk about calibration. This is a very important point that I want to bring up with you, You'll notice on the tablet that there's both the manual and automatic. And by the way, for those who are viewing the screen with all the jitters that you're seeing on my screen, that's just the function of the data feed, but it's not on the tablet. So on the left-hand side, you'll see manual, and on the right-hand side, you'll see automatic. So one of the things that I need to sort of qualify with you is the importance, we talked about the placement of the finger cuff, but really, there's the 3 Ps, which are critical to be getting the caretaker going, which is placement, perfusion, and the pressure of the cuff on the finger. Those are sort of 3 important components that all need to be converged to be very successful with the automatic calibration on the right. So automatic calibration on the right, Dr. Wilkie, for your benefit, and because you're like to probably do deep dives into technology, does both the baseline, established baseline BP and calibrate. The manual on the left-hand side does not establish baseline. It only calibrates to a provided value. So, just to kind of give you guys some visibility on how our customers use it, most of our clinical customers actually use the manual calibration with a brachial cuff on the left, as opposed to the automatic calibration on the right. And the reason for that is there can be variability in the automatic calibration depending on the 3 Ps I mentioned to you. And from a clinical workflow perspective, most of our customers want to get the patients on and running without having to worry about whether or not they're going to have a successful automatic calibration. So, places like Johns Hopkins and Cornell and University of Florida, University of Virginia, University of Colorado Health, they all use the manual calibration, partially because their institutional policies require that a brachial cuff is used as the starting point. It's up to you to decide how you want to use the caretaker. For the purposes of this training, I'd like you to go ahead and hit start under the automatic side, Raul or Dr. Wilkie. And Raul, your hand should be placed at navel height, and you should be still and quiet. Now, right off the bat, you'll notice that we have the cuff too loose message. So what I'd like you to do is just readjust the cuff, Raul, so it's a little bit more snug on your finger.
Okay.
Okay. Now again, what I'd like you to do, Raul, let's just get you to keep your hand still for a second, and let's see if we can see a pulse pressure wave off your finger. Okay, so this is an important note. Do you see what's going on the screen, Raul?
Yes, sir.
Okay, so what we're seeing is a pulse pressure wave, and we're seeing a very clear dichrotic notch on that pulse pressure wave. So what this is telling me is you've got your cuff on correctly, and we're already starting to see a good pulse pressure wave. So go ahead, hit start one more time. You won't have to enter the patient ID again, and then you just, yes, hit start under automatic. Again, at navel height, still and quiet, and I'll explain to you what's going on the screen. So what you're going to see is you're going to see pulses and then a flat line. And what you're going to feel during the flat line is the pressure of the cuff increasing, Raul. And then the pulses are when the caretaker is listening for the signal. Dr. Wilkie, if you look at the bottom right corner of the tablet screen, what you'll notice is there's a cuff pressure value, and that cuff pressure is increasing by small increments. Okay? So basically the cuff inflates, the caretaker listens. The cuff inflates, the caretaker listens, and it repeats this cycle until it gets through the calibration. So we'll let this go ahead and push through, and then we'll see what we get on the other side.
John, I know while I was calibrating, I may be jumping ahead a little bit, but I know Dr. Butler, I saw the email going back and forth about the ECG monitoring.
Yeah.
Sure, we'll get there, but
Yeah, we're going to cover the ECG as well in this session.
Yeah, I didn't pull anything out, so I didn't know if
Okay.
you
Yeah,
read
no,
something in advance.
no problem. So, Raul, what I'd like you to do, just go ahead, hit start one more time, and let's just run the calibration one more time. Okay. Now, this process that we're doing with the automatic calibration, again, part of this is a little bit of learning curve right now. So, it may take us a few times to do it, and it's going to probably take a few times with practice to get it really nailed down. But like I said, I just want to caution you with the automatic calibration because it is more temperamental than the manual, and I'll show you that in a minute. So we'll just let it go through and run the calibration again. For whatever reason, and I don't know if it was maybe a little bit of noise or movement in the hand or something like this, but it decided that it didn't like the signal quality, so it aborted on the last attempt. So we'll let it run through again here.
The other problem is that we've had suspicion that Raul may be undead, so he may not have
Okay, so here, I want to illustrate something to you guys before we do this again. Before we try to adjust the cuff, Raul, go ahead, or Dr. Wilkie, hit start. This time under the manual calibration. Raul, just a quick question for you. What are your typical BP values?
Usually below 120, 118, 112.
Okay, so type in those values, Dr. Wilkie, for the systolic, and what's your diastolic, Raul?
75 is good.
Okay, hit start. So let me show you the difference between automatic and manual. Should wind up here in just a second. Yeah, so it's done calibrating, and we'll see the values come up on the screen in just a minute. There you go. So you see the difference between manual and automatic, Dr. Wilkie?
Yep. I like manual.
Yeah, the thing with automatic, and what I would encourage you guys to do is certainly work with automatic a little bit, just on the side, more for a training perspective. Automatic's good for working with practicing on cuff placement, but as you can see, Dr. Wilkie, manual is basically is almost bulletproof. It has to do a lot less work because it's not establishing baseline values. Does that make sense?
Right.
Okay. Now,
Right, by the way.
a couple of things I want to show you very quickly. Tap with your finger, tap once where you see the BP numbers on the screen. So what we're seeing here is a graphical trend of the session. This will update automatically. And so, for longer sessions, of course, you'll see more and more data on this screen. You can go in and you can see a graphical trend for your patients. Tap on respiration and then tap on heart rate. Same thing with both parameters. Any of the parameters that you see on your unit, Dr. Wilkie, you can tap on once and you'll be able to see a graphical summary. Now, let's talk about the respiration. Respiration is only effective on patients that are sitting or lying still. If you have a patient that's talking or moving around a lot, the respiration values are going to be a little all over the map. So just keep that in mind because we use a combination of heart rate variability and thoracic pressure to calculate heart rate and our respiration rate rather. And our limit is 6 to 30 breaths per minute. So just keep that in mind as well. Hyperventilating is not going to end well for you if you want to try and see what we can do. By the way, Raul, nice resting heart rate.
Thank you.
You must be in good shape.
I like to think so.
Okay, so next step, let's go ahead and let's get the pulse oximeter connected. There was a pulse oximeter that was included with your kit. So I'd like you to slip it over top of your finger and turn it on.
Same hand or different hand?
Your choice. You do same hand. Tell me when it's turned on.
It's on.
Now, what I'd like you to do is with your finger, I'd like you to push and hold the SPO2 box on the tablet screen. Okay, let go. So orange means it's about to connect, and in a minute here, it should turn blue, and there's your pulse oximetry. Okay, any questions so far?
No.
Okay, if you tap on SPO2, Dr. Wilkie, you'll see, again, you can see the graphical trend, okay? And you can close that down. Now, one other thing I want to show you before we get into the ECG side of things is I'd like you to, with your finger, push and hold over the BP panel. This is a user-generated event that you can use to enter in any texts for the report at the end of the session that's relevant. So for example, if you're administering a drug via IV, or there's some significant event with the patient that you want to note for the file, you can put it in here. Okay. Okay. And then when you're done, just go ahead and click OK. Perfect. Okay. Now, let's do this next. Do you have the ECG unit handy?
Maybe.
Maybe. little small case like this.
Oh, sure.
Oh, got it.
Okay. And did you have it charged and plugged in and charging?
Let's see.
Where's no?
That one's.
There another? Is it? That's probably this one.
Okay, so yeah, let's go ahead. So chances are, Dr. Wilkie, it's probably not charged at the moment. So let's plug it in and charging, and by the time we get towards the end, we'll be able to. I'll be able to show you how to get that connected. And you know,
This is continuous blood pressure monitoring also.
this is what you're seeing right now, Raul, is beat by beat blood pressure.
That's great.
Okay, so
The light came on. I don't know if the different color lights indicate charging status, or I don't know.
White means that it's charging. It'll turn green when it's fully charged.
Got it. Thank you.
So we'll leave it sit for a few minutes. All we need is enough juice in it to get it going, and then you guys can fully charge it afterwards. So a couple of things just to show you from a maintenance perspective. Raul, how does the cuff feel on your hand?
It has a firm grip.
Okay.
Not uncomfortable. Just
It's snug.
the
Oh, I was just checking that to make sure that was.
cuff feels fine. Everything feels comfortable.
Good. So here's the thing. If you look in the bottom right corner of the tablet screen, you'll see there's a cuff pressure area, and you'll see plus and minus on either side. You really don't need to adjust the cuff pressure other than if you have a patient say, oh my gosh, this thing's on really tight. Okay. So if the cuff is on very tight, you can use the plus or minus to, minus to subtract pressure in the finger cuff. If you look right next to the cuff pressure, you'll see SNR, which is the signal quality that we're getting from the cuff. Right now, we've got full bars. If we're not getting a good signal off the cuff, you might see only yellow bars. 2 seconds here. Somebody that's
Somebody needs to have mute.
Hang on, let me just switch over right now. Okay. Oh, I guess that was Keith, maybe. Yeah, it must have been Dr. Butler. Okay.
Nope, I'm muted. It is not me.
So I think it was Tyler.
Oh, okay. But yeah, Tyler looks like, yeah, it might have been Tyler. Okay.
Yeah, I just unmuted, but now I'll mute again.
Oh, okay, no problem. Okay, so ultimately, the only time that you ever need to adjust the cuff is if a patient might complain it's too much pressure. But just keep in mind that you want to watch the signal to noise bar chart. If you lower the pressure on the cuff, you still want to make sure that you've got basically some green bars going on. Make sense?
Okay.
Okay, other than that, we've kind of covered everything. Now, let's go in, hit the icon in the top center of the screen that looks like the gear. Okay, so in here, a couple of things that I want to show you. Dr. Wilkie, in the locations where you're going to be distributing these units, will they be in fixed rooms, or would you expect that the unit would move around as needed?
It'll move around as needed.
Okay, so it would only be in fixed installations where we could set the location. That would make sense, but if you're going to move it around, that doesn't make sense. Go ahead and click alerts right below patient info. Now we can set high and low parameters for all the different alerts on the tablet, and these alerts will get captured in the report. So what I'd like to do is go ahead and tap on the max next to systolic, Dr. Wilkie. And let's sabotage it for Raul's report here. Put in 100 or 95, yeah. Hit OK, and then turn it on. Go back to the vitals screen at the top. Okay, so what we're going to get is we're going to get a visual and audible alert on that tablet that there's something that's not right. Okay, and what you'll notice is if you hit the clear button at the bottom of the screen, that alert's just going to come right back. So these are latching alerts. The only way that they can be cleared is if they're either toggled off or if the patient falls back to within range. Okay. The other one I want you to do, Dr. Wilkie, is just toggle audible heart rate on. And then go back to the vitals. And you should hear the audible heart rate on the tablet.
Sure.
Up to you to decide whether you want to leave that on. We see our sedation, oral sedation and sedation dentistry people use that, but it's up to you. So you can go ahead and toggle that back off. And then last but not least, and this is only for you guys to, just for your reference, we do have the ability to do spoken pulse oximetry. So if you have a patient being monitored with the unit and you don't necessarily want to be looking at the unit, but you want to be aware of possible desaturation, you can set up the spoken pulse oximetry and you could use that if you want, but we can skip that for the purposes of today, okay? Now, go back to the gear one more time, Dr. Wilkie. I just want to show you a few other things. First of all, go to display settings. See where it says caretaker device display. I'd like you to toggle that to off.
Caretaker device display.
Yeah. And look at Raul's wrist.
Oh, okay.
Caretaker will have gone blank. That takes the battery life of the caretaker from between 8 to 12 hours to more like 16 to 20 hours of operation. Not that you guys will ever use it, but certainly if you're doing a long-term monitoring and the patient isn't really going to be concerned with what's on the screen. And frankly, most of our customers don't ever refer to the data on the caretaker screen. So it's up to you to decide whether you want to use that or not. If you want to go ahead and toggle it back on, you should see the display on the caretaker turn back on again. Okay.
I'm going to turn it off.
So go ahead and go down to app settings. Sorry, one more down. Sorry, two more down to advanced. See where it says disable stop button? I'd like you to toggle that to on. I'll explain what that does. If that is left off, if one of your patients gets curious and decides to press the button on the top of the caretaker during a session, it will stop the session. Toggling this to on disables that stop functionality. So if they press the button accidentally, it won't disrupt the monitoring session at all.
Is there a setting so that if somebody tries to walk out with one of these, we'll get an alarm?
Unfortunately, no. Other than to say, you will notice on your caretaker's screen a message that says caretaker disconnected. So you'll have a chance to at least chase them out into the parking lot.
Okay.
Okay. Now, I want to show you one other thing. If you look where it says ECG serial number right now.
Yes, sir.
Okay. Unfortunately, the ECGs can't float around between caretakers and tablets. It's a one-to-one pairing. So in other words, what you're going to want to do is you're going to want to keep one ECG and one tablet paired together whenever they move around the facility.
Okay, so tablet, not caretaker device,
Correct.
not the wrist device, so just the tablet.
Just the tablet. The caretakers can float freely. The ECGs must be kept with their married pair tablet. Okay. So that ECG you just plugged in, Dr. Wilkie, if you take a look on the back of the charging case, you'll see a lot and a serial number on the back. And if you want to compare that to what's on your screen,
Yes, sir.
does it match?
It does match.
Perfect. Okay. So just keep that in mind. And obviously, if the ECGs get switched in charging cases, it's probably better to refer to the serial number on the actual ECG patch than on the case.
So can we, will the device have more than one ECG that it compare with?
Right now, we can only do a one-to-one. We will be adding the capability to pair multiple ECGs. We just don't have that right at the moment.
Okay.
So next up, we are going to get the ECG connected, but I want to wait, Dr. Wilkie, to give it some more charge time. Go back to the home screen now. And what I'd like you to do is I'd like you to hit done at the bottom of the screen. Now, at the beginning of the session, we entered in the patient ID. At the end of the session, the patient ID that we entered at the beginning goes on the PDF report. This information creates a folder where all the raw files go. So why don't we go and, in keeping with what you did before, delete log 2 and type in the king. Okay. Now, in this screen, otherwise, Dr. Wilkie, you're going to want to keep save history and generate report always checked. Okay? I wouldn't suggest changing that for any reason. Go ahead, click OK. You'll say generating report on the screen. And then what's going to happen now is you're basically out of a session. So your BP values won't change. Your pulse oximetry may change, but they're not being recorded. Now, one other thing I just want to mention to you, Raul, look at your finger right now. What does it say on the pulse oximeter?
99% and 54 beats per minute.
Yeah, so if you look on our screen, notice how it says 100. It said 100 briefly.
Right.
So the manufacturer of the Bluetooth pulse ox obviously wanted to save money. So they only put 2 digits on their display instead of 3. So when a patient's at 100 on that finger clip unit, it'll actually show 99. But on our app, we'll show 100. So there is only when they're reading 100 and displaying 99 where there'll be a disagreement between what we're showing you and what it's showing you. Okay? We had one customer bring that up, and it was like a major problem, and we, determined that that's the reason why they just didn't put a 3rd digit on their display. Okay, so go ahead. Let's go to the home screen of the tablet, Dr. Wilkie. You'll see there's a folder there that says reports. Go ahead, click on that. And open up the bottom report where it says the. Drive PDF viewer always. Okay. Here's your report. Now, a couple of things I want to note to you. That vertical blue line that you see on the graph about a quarter of the way over, that was that date timestamp where you said started the vasopressor.
Yeah.
Okay, and I'll explain a little later. Before you scroll down to the very bottom, Dr. Wilkie, just want to show you, you'll see patient ID, the king, and the top left. You'll see a start time, stop time, and the duration of the session, which was 16 minutes, 23 seconds, okay? So now scroll down to the bottom of the report. So we get statistics, maximums, minimums, averages, standard deviations on all parameters. You'll see that there's alert statistics. You would set the systolic high limit to 95 because Raul was consistently over 95 for the entire session. It shows that he was over for the 100% of the session, 1531. A couple of other things I want to show you. Right down below in the event table, you'll see it says CT session start. And it says the king and 112/75 were the starting values that were provided. Right below the session start, you'll see started drip of vasopressor. And you'll notice the values right next to that. In order, those values are systolic, diastolic, MAP, heart rate, respiration rate. So you can see what the BP values were at the time of administration. You'll see there's a BP alert right below that, and it says 95, 90, 150, 107, 72. So let me explain the values. 95 and 90 are high and low systolic set points. 150 are high and low diastolic set points. 107 and 72 are measured values. So it shows you why it alerted, which was the 107. Finally, if you look at the very bottom table, you'll see that we issue a 5-minute vital survey. So these are the vital signs captured every 5 minutes. So over a 50-minute session, you'll have 10 recordings because we were, basically the start of the session and then every 5 minutes through it. Make sense?
Yes, sir.
Okay. Now, let's go ahead and let's go back to the home screen again of the tablet.
If we want, I'm just going to look real quick. So Tyler, you may have to help us. So if we want to print this, so we scan it and include it in our data that we scan into the chart. I guess we'd select a printer and.
Well, I talked to Tyler about it earlier, Dr. Wilkie. We've got an even more slick arrangement. There is a file sharing software we can install on the tablet where it'll automatically upload it to either a secure FTP, Dropbox, OneDrive, Google Drive folder, where you won't have to print it and scan it. It just uploads automatically, and then you retrieve the PDF and attach it directly into the patient record.
Okay.
So that's up to Tyler. And I told Tyler that, we can certainly take that conversation offline from today. But as you've already seen, there's a couple of printers that are already showing up on your network there. You could send this report to one of those printers right now.
Okay.
Okay.
I don't know how to get out of this.
Yeah, the printing and the scanning is probably not the most elegant solution. We do have customers that do it, but I'd say, many of our customers use the file sharing software that I've already described.
So how do I get out of the screen?
Okay, just go to the home screen of the tablet.
Okay.
Okay. Now, I'd like you to open up saved logs folder, Dr. Wilkie. And go to the second one down where it says the at the beginning. These are all the raw data files for the session. Open the very bottom file where it says vitals. And do sheets always. No. Raul, this is you beat by beat. So let me explain the data. The data comes in payloads, Dr. Wilkie. So what you might notice is that if you look at the timestamps, you'll notice that at some timestamps, there's multiple entries for the same time. So specifically at 8:31 and 43 seconds, or 48, I can't tell from the Zoom, there were 3 values that came through.
Okay.
Oh, sorry. At 48, there were 2 values that came through. So point is, those 2 values are absolutely different values, but they came delivered in a payload. So if you scroll over to the very far right side of the screen, you'll see there's a timestamp there in milliseconds, Dr. Wilkie. That's when the actual readings were captured at the wrist. A date and time stamp on the other side of the screen are when the readings were delivered to the tablet. So as you can see, all the readings are unique.
One thing I'm thinking of is if we do this a bunch and it does beat to beat, and let's say we have a large session, we're going to have a lot of data. Does this like auto delete after a period of time, or?
There will be a warning that comes up on the tablet and you can purge the data. So let me show you that right now. You go to the home screen on the tablet, open up the Caretaker software again, and go to the settings screen. If you go to, I'm going to try and guess at this here, app settings, you'll see that there's a clear logs button, and it'll also give you an available space. When your tablet runs low on available space, you can clear the logs.
Right, I'm going to clear them.
Now, just keep in mind that it'll take a very long time for you to fill up the data.
Right, we got 6 gigs. So.
Yeah. So just to give you an idea, a session is typically 5 megabytes per hour.
Okay.
So you can kind of do the math in your head a little bit, how many hours of continuous monitoring you might be doing on a Caretaker over the course of a month or a year, and then you can extrapolate how quickly you'd burn through your data. But very seldom have we had a customer that has burnt through, their available space. Okay. So we're going to get the ECG going. Raul, just go ahead and let's start another manual calibration session. Just accept the values that are there and hit start. Hand at navel height, still and quiet. Now, Dr. Wilkie, included with your ECG units were these packages. Yes, go ahead and open that up, please. In each one of these packages are the disposable adhesives for the ECG patch. So I'm going to hold up the patch here, and what you're going to notice is that on the patch, there's numbers on either side. So you'll see there's a 1 here, and there's a 2 on the other side. This is for applying the ECG. So the way that you're going to do it is you're going to take one of these patches, place it down on the table, and you're going to start by peeling off the side where it says 1.
Okay.
And then what I'd like you to do, Dr. Wilkie, is reach in, grab your ECG patch, which you can see here, and basically carefully place this patch so it's aligned with the adhesive area on that ECG patch that you just pulled the 1 off of.
Okay.
Now, next step is you're going to peel off the number 2, and that's going to expose the adhesive that's going to go on the patient. Now, let's talk about ECG orientation on the skin. I'm just going to show you the different orientations. So number 1 is on the ECG itself, Dr. Wilkie, you'll notice there's a heart symbol. Of course,
Sure.
You want to make sure that that heart symbol is upright. Obviously, if we do this, you'll end up with an upside down or inverted QRS trace. Okay? So a couple of options for placement. You can do vertical on the sternum. You can do the horizontal just adjacent to the sternum, so just left of the sternum, midway between nipple and shoulder. Getting a little bit echo here. Hang on 2 seconds. Hang on. There we go. We had somebody that had called in twice, so they were getting a little bit of echo. I think somebody, Gina. So again, midway between shoulder and left nipple, just to the left of the sternum, is where you can put the ECG patch. And in fact, what I do, doctor, is to enhance the QRS trace, do it just slightly diagonal, if you can see that on the camera.
Okay.
Nancy Henry joined.
And you guys can, you'll start to get a better experience for it. Raul, just give it a good press against your chest. One thing to note, if you have a patient that's exceptionally hairy, you're going to want to probably deal with shaving the area.
All right. All right. Did it work? Let me
Okay, so
check.
now, what I'd like you to do is push and hold over the ECG box on the tablet. Okay, and let's wait. Hopefully we got enough charge on that ECG to get it connected. There it goes. So it's turned blue. In a second, it'll show a battery indicator. And now it's synchronizing, so we should see the ECG trace come up. Okay, now it's going to take a few minutes. Oh, not a few minutes. It's going to take a little bit for the hydrogel to warm up. But now we're getting the ECG trace in. Any questions?
Nope.
And then basically, if you wanted to disconnect the ECG or the SpO2, you would just push and hold on the boxes on the screen. Okay. Now, a couple of things just to talk to you guys about in terms of connectivity. Raul, if you say, if you were a patient and you had to go to the washroom, you could stand up, walk out of the room with the caretaker, and what will happen is, depending on how far you go, the caretaker, the SpO2 and the ECG may disconnect, but they will reconnect when you come back into range. The only thing to keep in mind is that when you stay a distance away, it will, it will stay. You won't be recording any values. There will be no data coming through for the report. So just keep in mind that if a patient gets up and walks out, you're not going to be getting any data for the recording.
Okay.
Okay. Other than that, I think we've kind of covered everything, Dr. Wilkie. Is there anything that we've missed?
That seems pretty straightforward.
Okay. Now, the recording that I've created out of this session is, it'll take about 1 day for WebEx to process the recording and prep it. So
Okay.
I will send you a link, you and Dr. Butler, a link to the recording tomorrow for you to download it.
Perfect.
Okay. Tyler, are you still on the line?
Yes, I am.
So what do you want to do about discussing the layout of the different, using the file sharing? You want to take that offline?
Yeah, let's go ahead and take that offline. I'd actually, now, is it only FTP that you're able to do, or SMB? If it's FTP, then I've got to get that set up before we can actually test it.
I'll tell you what, Tyler, why don't you send me your metrics? My email is john@caretakermedical.net.
Okay.
And then I'll reach out to you. I've got another meeting I've got to dive into.
Okay. Sounds good.
Okay. Thank you all. I appreciate your time today.
Thank you.
Thank you.
Thanks.
Hi, Nancy. Are you still in the meeting room?
Nancy, are you there?